Here in rural Liberia, mental illnesses are considered a curse.
This is where they bring patients to.
And caring for people who suffer from the most serious of these illnesses, from depression to schizophrenia, is often left to traditional healers who resort to the only treatments they know.
This is an African handcuff. Whenever you try dealing with mentally ill patients, we're so agitated to harm anybody, as you can see. Put your foot here and then release it.
Mental illness is widespread in Liberia, a country deeply traumatized by a long, brutal civil war that ended in 2003. It's estimated the conflict left more than 40% of Liberia's 4 million people with post-traumatic stress disorder. Health experts say the 2014 Ebola outbreak compounded that trauma.
Separation, grief, loss, trauma. You might not see them, but they're there.
Janice Cooper is a psychologist with the Atlanta-based Carter Center who led the mental health response to Ebola in Liberia. She says Ebola proved the global health community is unprepared to deal with psychiatric emergencies.
We would go to meetings and people would acknowledge, yes, psychosocial, that's important. But mostly they were thinking about how we could get mattresses and buckets and those kinds of things to people, and food, very important, but not about how do you address the problems of the mind.
Dr. Vikram Patel is a professor at Harvard University and an expert on global mental health.
In many parts of the world, mental health problems are already amongst the leading causes, not just of disability and poor quality of life, but actually of death as well.
That's because until recently, treating mental health conditions in resource-poor countries was considered a luxury, one that required access to medication and mental health professionals.
There are solutions, but one has to put on a certain set of glasses that allows you to see the world as being far more complex than one has been accustomed to seeing.
A growing body of research is proving a low-cost, community-based model of mental health care to be remarkably effective.
Probably because of rejection, probably because of stigma.
This model crosses cultures by training local healthcare workers like nurses to deliver basic mental health services such as counseling and behavior modification. In Liberia, this kind of program was first launched in 2011 by the Atlanta-based Carter Center. The Carter Center trained 144 mental health clinicians in Liberia. No small feat in a country with almost no access to medicine, and just one psychiatrist for a population of 4 million.
At times, people say maybe somebody bewitched another person.
These clinicians work with traditional healers, churches, and hospitals to deliver frontline mental health care that respects the culture in a country where the mentally ill are often outcast and sometimes brutally punished. Psychotherapist Rodney Presley is the former head of E.S. Grant's Psychiatric Hospital in Monrovia.
There are people chained like dogs to a tree because the family just doesn't know what to do. They don't know that there's treatment available. They're under the impression that the individual has been witched or is possessed.
Aaron Deba is a graduate of the Carter Center program and is the only mental health clinician in Nimba County, a rural part of Liberia that's home to 500,000 people. Deba works with Ebola survivor support groups in Ganta, a city devastated by the virus. Survivors not only suffer lingering physical ailments like joint pain and vision problems, they often suffer depression and anxiety.
The group today were the continual needs of people affected by Ebola, and also helping to support children or orphans affected by Ebola.
I'm Jacqueline Tissé, survivor from this epidemic. I got sick, I lost my husband, a mother, a father, and other people. I lost 8 persons from my house.
Coming together at least once a week, at least once a month, is so much important. This thing will strengthen us.
2 years after Ebola, the Liberian government passed legislation to make mental health a nationwide priority. But it has yet to dedicate the required funding. This raises serious questions about the long-term effectiveness of mental health programs like the Carter Centers, says Director Janice Cooper.
We're really hopeful sanguine about the aftermath of Ebola in terms of having more resources for psychological, psychosocial, and mental health services.
For now, this leaves mental health care in most developing countries to a small but dedicated number of local health workers who lack the support and resources needed to do their job. For the PBS NewsHour, this is Molly Knight Raskin in Ganta, Liberia.